Cool. Hi everyone, my name's Natascha Eden. I'm the nurse consultant in CAMHS in Southampton. I've been working with young people, well, I don't know, maybe about 7 or 8 years now. Before that, I was working adult mental health. And one of my kind of, I don't know if you want to call it a specialist interest if you like, but I suppose it is really, is how do we support young people that self-harm, and how do we support parents to support young people that self-harm. So I've put together some slides for you today. So I hope they're kind of useful, and I'll share them in a minute. If you have any questions or anything, then obviously you can either wait till the end, or if you want to pop them in the chat as we go, I'll try and monitor that. Or again, you can just shout out over the microphone. So whatever you feel comfortable with, really. So is it okay if I start? Hopefully I'm going to share my screen and that will go okay. Sometimes that can go a little bit odd. And if I'm not looking straight at you, it's because I have 2 screens and my camera's on one of them. So I'm not being rude or distracted. So I'm going to try and start the slideshow and share my screen. So hopefully this will work.
I hope I've said it so that you can share.
So,
there we go. Perfect.
Can you see that slide? Yeah. Okay. Now right. Oh gosh. Hang on. Let me stop sharing because I've now gone through my slides quickly. Sorry, this is my badness with Zoom and doing these things.
It's never easy to get them all to work at the same time.
Right, I got a little bit click happy, I think. Right. So so I guess the first thing is what is self-harm? So in the kind of medical sphere, they like to give things lots of fancy names, don't they? Sometimes lots of long names. So you might see it called non-suicidal self-injury, or described as NSSI. The kind of medical definition really is deliberate or direct destruction or alteration of body tissue without conscious suicidal intent. And it's deemed not acceptable in society, and it's direct, repetitive, and it leads to minor or moderate harm to the young person or the person that might be engaging in this. So it's used to describe all intentional acts of self-poisoning. So for example, overdoses, cutting, irrespective. So it doesn't matter whether there's a degree of suicidal intent there or other types of motivation. And it does also include acts that may be intended to result in death or attempted suicide. And I guess I just also want to say, actually, which I should have said at the start, I'm sorry if this might be a bit triggering for some people. And I understand it's a hard topic to talk about and it might be quite upsetting. So if you are feeling upset or it's a difficult subject, then obviously please contact Jill or one of the other kind of moderators and get some support for that, because obviously I wouldn't want anyone to feel distressed or upset by what we're going to be talking about. Sorry, I should have said that at the beginning. So I guess that's kind of the sort of definition really. So I thought it might be worth us just thinking about how common this is. So I was looking at some research papers. So this data comes from a paper from the Lancet that was published in 2019. So a fairly recent paper, although the data is a little bit old, but it does show us some stock statistics really. So 1 in 5 16 to 24-year-olds had engaged in self-harm. So that's quite a significant amount. And we had data from primary care, so that's GPs, that showed that rates of self-harm had increased by 68% in girls aged 13 to 16 years. Interestingly, the rates had not increased in boys actually over that time frame. And the proportion of the population that reports self-harm to relieve unpleasant feelings of anger, tension, anxiety, or depression actually increased from 1.4% to 4%. And that was across all age ranges and age groups. And if we look at lifetime prevalence rates, so this was a study that was done between 2012 and 2014, a different one. In adolescents, it's 17.2%, in young adults, 13.4%, and in adults, 5.5%. So in the CAMHS population, so we're probably talking about mainly adolescents, maybe some young adults, it is quite a significant problem, and it is something that we do need to be able to tackle, really. So if we're looking at types of self-harm, so it could be something like intentional overdose, self-cutting, burning of the skin, repeated head banging, attempted hanging, misusing drugs or alcohol, hitting or punching yourself, or restricting food and fluid intake. And obviously that could also be signs of an eating disorder, but it can be signs of self-harm, and sometimes these things can overlap a little. So the most common methods of self-harm are overdose at 68.3%, followed by cutting and then hanging. And the highest risk of somebody doing that repeatedly is in the age groups of 15 years or over. And the average age of someone starting to self-harm is about 13.9 years, so 13 to 14 years of age.
Natascha, can I just check, are you meant to be sharing your screen now?
Yeah.
I wasn't sure if you, you're not currently.
Oh gosh, sorry.
No, that's fine. I didn't want to interrupt you, but I just wasn't sure if you were going to be showing the slides.
That better?
There we go. Yeah, that's great.
Sorry.
Thank you ever so much.
There were slides for all the other stats as well. So
if you're able to let us have a copy of the slides, then I can share them with the group later, if that's okay.
Yeah, of course.
That'd be brilliant. Thank you.
So if we're thinking about signs of self-harm, so as a parent, obviously you might be wondering, is my child or young person, are they engaging in self-harm? You know, you might be concerned about that, you might not know. So if we're thinking about the signs, it might be something like checking for things like unexplained cuts or bruises or cigarette burns. So normally on wrists, arms, thighs or chest, but could be anywhere in the body, but arms, thighs or chest are probably the most common. Maybe if you've got a young person that actually used to be happy going out in shorts and t-shirt or wearing clothes where they bared their arms or their legs, and now they're kind of covering up a lot, you know, that might also be a sign. If someone's maybe pulling out their hair, whether you're seeing signs of alcohol or drug use, you might hear your young person saying that they don't like themselves or expressing a wish to punish themselves in some way, or maybe, you know, saying things like, I don't want to be here anymore, I don't want to go on. You might notice that somebody's becoming withdrawn, not wanting to talk to people. Could be changes in eating habits, and just signs of low self-esteem. So maybe looking for blaming themselves for problems or thinking they're not good enough. Or we could be looking at signs of depression or low mood, so tearful, lack of motivation, no interest in things they used to enjoy, struggling to get out of bed, maybe sometimes struggling to do simple things that are really hard when you're low in mood, like getting dressed, washed, brushing your teeth. Those things can become really difficult if somebody's low. So this isn't an exhaustive kind of list, but it just gives you an indication of maybe what some of the signs may be, and just a few things to just be aware of, I suppose, as a parent. So I guess the next thing is actually why, because I suppose for some people that can be really hard to understand why somebody would, you know, would harm themselves or hurt themselves. And I guess there can be lots of complicated, multiple reasons. Tried here to just put them into things that are kind of tangible, easy for us to kind of understand. So I guess if somebody doesn't have the language to talk about how they're feeling, or it's really hard to put that into words, that might be a way of relieving that stress or that pain. turning invisible thoughts or feelings into something that is actually visible. Because mental health problems they're invisible, aren't they? And that can be really difficult. So sometimes it might be easier for somebody to turn that into something that people can see, something that is visible. And again, you know, physical pain may be easier to understand. So sometimes people would prefer to change that emotional pain into something tangible and physical. You know, I hear a lot of my young people using this as a way of reducing that overwhelming emotional feelings and thoughts. If your life feels really out of control and you don't feel like you've got a lot of control over things, which a lot of young people don't, you know, they might have parents putting rules and boundaries in, they might have, you know, feeling controlled at school, you know, there might be problems with peer pressure. So if they have a sense that they're not in control of their life, this might give them a sense of control. You know, a lot of people, you know, may have had traumatic things happen to them in the past. They might be having memories or flashbacks. So again, it can be a way of escaping some of that. So a coping mechanism for that. Just having a coping mechanism that they think they can rely on. So having something that's there all the time for when they're feeling bad, that they know, you know, helps them. Or it might be actually if someone's feeling a bit of shame or guilt about something, it might be a way of punishing themselves for that. Sometimes, you know, people feel numb, disconnected or disassociated. We probably don't have time to talk about dissociative disorders today, but again, you know, that I guess sometimes what people describe is a sense of being out of their body or not connected with reality or not really there. So sometimes this is a way of maybe grounding themselves and actually coming back into the moment. Creating a reason to actually care for themselves, and a way to kind of express their suicidal feelings and thoughts without taking their own life. So again, this isn't really, you know, there's lots of complex reasons and it's not an exhaustive kind of list, but it is hopefully will give you an idea of perhaps what might be behind self-harm, because I think actually probably when you see someone has self-harmed, you know, you yourself, it might invoke feelings in you of distress, maybe even of that could turn to anger sometimes, you know, frustration, worry, and it might help, you know, to maybe understand what might be underneath the self-harming. And sometimes I think, what's the function of the self-harm? What's the function of that behaviour? You know, what's underneath it? And that might help us understand, you know, why someone is doing this. So hopefully, I don't know if anyone's got any questions about that, but hopefully that's sort of helpful in a way.
That's really useful, I think. And I'm really interested to see that just even the thoughts about sort of suicide and harming yourself without actually doing it is kind of under the umbrella of self-harm as well. I wasn't aware of that previously.
Yeah. So we just need to, you know, again, it's just a way of us just being aware and trying to manage that. And again, it's a difficult emotive kind of subject, isn't it?
Oh yes.
And I think one of the things that I think was asked was how, you know, how do we broach this subject with a young person that is self-harming? You know, what do I say? What can I do? So these are just a few tips, you know, for the first conversation, really. So staying calm, I suppose. So a lot of young people, when they come and they talk to me, and I say, well, you know, have you spoken to your mum about this, or someone in your family or your friends? And they say, well, no, because I'm really worried they're going to be angry with me and they're going to be really cross with me. So that is a worry that young people have. So I think that the thing here of staying calm is quite important, and actually just being being able maybe, and again, I've touched on it in the reasons, like if your child is self-harming, it's going to invoke lots of difficult emotions for you. And it might be quite difficult to stay calm, but I think if you can find a way of doing that, it is really important. Because I think what that young person probably is looking for is for you to be able to hold some of that emotion, and for them to feel that you can hold that. So you might feel angry, you know, you might feel frustrated, you might just be really, really worried, you know, but if you can sort of stay calm, you know, then that will open the conversation up more, really. So one of the things that again that young people struggle with is perhaps if they don't feel their emotions are validated, and that can be that is a big thing for lots of young people, and that can either be by parents or it could often by friends or teachers, and they feel that actually my feelings aren't important, I don't feel validated. So it's really important to acknowledge the emotions of your young person, yeah, and to view it as a sign of emotional distress. So maybe trying to ask some open questions, you know, how are you feeling? Do you know what you're feeling? And just see if you can maybe get them to express some of that emotion. You might feel that you urgently need to understand why they're doing it. I mean, sometimes that young person might not really understand or realize why they're doing it. Some of those reasons that we talked about on the previous slide, you know, some of that could be unconscious thought as well, as opposed to conscious thought. So sometimes the young person might be even confused about why they're self-harming. So it's just important to try and give them an open space where they can talk in their own words. And again, I think, you know, just compassion, care, concern. So just trying to show that young person that, you know, you're hearing what they're saying, you're going to show them compassion, you know, and concern. And I think that goes a long way, really, when trying to open up those conversations. And then I think one of the other things young people talk to me about a lot actually is how embarrassed they feel about it. So they often feel really embarrassed, often feel really apologetic, or really sorry about it. And again, that's another way of perhaps them experiencing shame, or perhaps them also maybe invalidating their own emotions. And there is quite a lot of stigma around self-harm still, you know, and you know, recently we've had issues with schools and various other people where they've reacted in, you know, maybe slightly inappropriate ways. So actually saying, you know, letting that person know that they don't need to be apologetic, you know, that their feelings are valid, they don't need to say sorry to you, that you will do what you can to support them to find a way through this difficult time period, I think can be really important as well. Because if someone feels like they're being judged by others, they're more likely to withdraw and not want to share their emotions or their experiences, and then they're more likely to, you know, to do that, to self-harm or do the behaviours where you maybe try and hide it even more. So it's really important to try and not be judgmental about it, because again, there is a lot of stigma, and young people that do this, they do feel often really really embarrassed about it at times. Does that all kind of make sense?
Yeah, absolutely.
Yeah. Okay. So again, just a few things about what you could say. So again, you know, these might not be words that you might use. You might want to change the language or change the words, but it's just a few sentences that maybe just some ideas about what you perhaps could say. to your child or your young person. Yeah. You know, and again, showing, you know, concern, so you know, showing care. And again, if you know, if someone doesn't want to talk about it, you know, saying, you know, just acknowledging that you know that, you know, they're in emotional distress because you've noticed that this is happening, but actually it's okay if they don't want to talk about it right there and then, but you're there for them when they're ready, I think is important. Because I think if you really push someone when they don't really want to talk about it, that can also make them feel very uncomfortable, and possibly make them retreat even more. So again, there's probably lots of other things that you could say, but I just popped a few on here, just some suggestions really, again, because I think that was something that was requested. Okay, and then maybe things to avoid saying. So I haven't put lots on here, but anything that is invalidating, so something like, oh, I don't know why you're doing that, or things aren't really that bad for you, I don't understand, there's a lot of people more worse off than you. Those are probably really invalidating things, and they are things that have been said to young people. So if you can perhaps maybe avoid saying things like that, that's probably a good thing. Giving people ultimatums, so saying something like, well, if you don't stop doing this, then you know, I'm not gonna take you to see your friend on Tuesday. Yeah. Or any other kind of ultimatum. You know, I think schools will sometimes give ultimatums, you know, if you don't stop doing this, then we won't let you back in the classroom. Yeah. So I think things like that probably aren't helpful, because I guess what we need to understand is that the young person, you know, sometimes they might want to stop, but they feel they can't. Sometimes actually the young person is saying, this is a way of coping, I don't want to stop this right now. So if we give them an ultimatum, you know, I think with any ultimatum in any situations, they're generally probably not helpful ways to manage it. And then again, asking to see, or being really kind of what people call, what I suppose, voyeuristic, can really make people feel uncomfortable sometimes. There might be times when you've built up a relationship that you are able to ask that, when you've built more of a rapport and you are having conversations about the self-harm, and there might be some really valid reasons for needing to see self-harm, in as much as checking for, you know, wounds, making sure they're not infected, making sure it's clean, and just the kind of first aid management of that. But I think if it's the first time that you've noticed that this is happening, and that's one of the first things you say, that could probably be a bit off-putting. So again, it's all about context, because you know, it sometimes can be useful, and I haven't actually put that in these slides because I've been focusing more on the emotional side of things, but obviously there is a kind of first aid side of things that is useful to be aware of as well, that does need to be addressed at times in terms of physical health.
How would you do that if so your child is self-harming but they won't let you see? How can you be sure, and sort of when do you need to step up for that first aid side? It's quite a difficult one to know how to judge.
It is difficult. I think probably the first thing I would say would be, okay, I understand you don't want me to see, and then I would maybe just say, you know, I am obviously really worried about you, and I'm worried about, you know, whether or not that, you know, whatever you've done, whether it might be, you might be infected, or, you know, you might need to go and see someone to get antibiotics. And then I might just say to them, you know, just something like, you know, did you use something that, you know, what did you use something that's clean? Have you cleaned the wound? And then I often just talk through with young people what the signs of an infected wound are. So, you know, things like swelling, things like if there's any discharge or any pus or any pain, whether it's hot to the touch. And I might just say to them, look, if there's anything like that, you know, then actually we need to go and see the doctor. And if you notice perhaps that, you know, there is a bit of swelling there, or, you know, they're in a lot of pain when they touch it more than if you would just have a cut or a graze, you know, then I might say, look, I've noticed it looks like you're in quite a lot of pain there. You know, maybe we need to go and get some antibiotics. So I would perhaps just give them some information about, you know, what it looks like if perhaps it isn't healthy. And then I find usually most young people will then come to you if they think there is something wrong with it, with the wound, once you've given them that information, and then they're in control of it most of the time.
Yeah, no, that's really useful. Thank you.
Yeah, and also, you know, sometimes just giving them some, you know, some Savlon or antiseptic, you know, telling them about cleaning and first aid, just giving them that information, not because you want them to carry on self-harming, but I suppose it's more of a harm minimization type strategy. And I guess at that point in time, what we're having to do is accept that at the moment, our young person is using this as a way of coping, and we need to minimize the harm from that. And the way to minimize that is to teach them how to look after any wounds they might have. And that's not to say we're condoning it, because we can definitely say, I'd rather you weren't doing this. I'd rather that we were able to help you to find different ways of coping, but understand at the moment, you know, this is how you are managing. But we need to try and help you do that in a safer way. I suppose that's how I would put it.
Yeah, that's really useful. Thank you.
Yeah, so yeah, sorry, I haven't focused much on the physical management, but I can always do another talk and tweak and change things a little bit.
Okay, thank you.
So how can we manage self-harm? And again, I've just focused on the kind of emotional side of it, and I've tried to break it down into the emotions that might be driving the self-harm, and how we can use coping strategies, or how a young person can use coping strategies to perhaps manage some of that. So I suppose the first thing is about recognizing the triggers. So the thing that gives somebody the urge to hurt themselves, so it could be anything. So it could be a person, a situation, anniversary, a place that reminds them of something. So again, we love diaries in mental health, don't we? We love a good diary. But there are some really good reasons for that, which is about noting down patterns and thinking about what was happening just before you self-harmed. Were there any particular thoughts? Was there somebody that reminded you? And I suppose the reason for using diaries is that there are lots of things that might trigger us unconsciously that we may not be aware of in the moment, especially if it's been really overwhelming. So by noting it down and keeping a bit of a log of where was I when I had this thought or this feeling, you know, what was I feeling? What did I then do? What happened afterwards? If you do kind of keep a log of that, it does help you recognize triggers, it helps you recognize patterns, and that can then help you in terms of, you know, other things I need to avoid. Yeah, so I don't know, do I need to change my route to school because actually I know that if I walk this way, I go past this particular place where this happened, and that is a trigger for me. So do I need to go a different way? Yeah, or do I need to speak to school about going in half an hour earlier or half an hour later so that I can avoid something? Yeah, so it's not all about avoidance, but you know, there might be some things that you notice that you think, oh, actually, yeah, we can make a change here, and that will help us eliminate that trigger. So that's kind of the reason behind that. So it also helps us become aware of the urge to self-harm. So urges can include physical sensations. So we might, again, have a racing heart, a feeling of heaviness, might feel very sad or angry. We talked about that dissociation or disconnection. and there might be some repetitive thoughts. Yeah. So it's about writing down and noticing those sorts of things to help you spot them more quickly the next time. Yeah. It does take a bit of practice. And I can, again, provide, you know, things like diaries and things. I can send them through with the slides if that would help.
That'd be really great. Yes, please. Thank you.
Yeah. Okay. So again, I've tried to kind of break it down into the emotions. So thinking about, you know, self-harm. So if the driver is something like anger and frustration, things that might be helpful. And again, we're all different. So what helps me might not be what helps somebody else. Yeah. So I'm, you know, I like to do kickboxing. So if I'm feeling really angry and frustrated, I'm going to get my gloves on and I'm going to punch the bag. But somebody else who doesn't like that, that's not going to work for them. They might need to do something else. They might need to listen to music, or they might need to, you know, go out for a little dance or phone a friend. You know, again, it's all very personal, but these are just suggestions. So possible distractions for anger and frustration, so exercise. So hitting soft things like cushions or pillows, yeah, so rather than hitting walls or hard things that might hurt. Shouting, dancing, shaking, so, you know, just shaking your body up, really intense movement, biting down on bunched up material, tearing something up into hundreds of pieces, going for a run. I don't know if any of you heard about this. I don't know if they still do it actually, but in Japan, what they had for people that were really angry and frustrated with their jobs outside office buildings, they would have people with stacks of plates. You'd pay for a stack. Yeah, you'd go into a little booth, you'd have a bit of a shout, you'd throw the plates, you'd smash them all up, and that would make people feel a lot better.
I love that.
And that was an actual thing.
Wow.
So, you know, things like that, but in a controlled way, can really help you get out anger and frustration. You know, there's a reason why people pick things up and throw them when they're feeling frustrated and angry. Yeah, because you need to get it out. So having strategies, you know, where your young person can do that, but in a kind of more controlled way, like something they can go and tear up if they're feeling really cross or angry, that it doesn't matter if it gets torn up or broken. Things like that might be useful. Yeah, it does work. So again, it's about trying things, and whatever works, keep that, and whatever doesn't work, just ditch it. Yeah. So things like sadness, fear, so wrapping a blanket around you. Some people like weighted blankets because that helps them feel really contained and calm. Some people like spending time with pets or animals. There's a lot of research around the therapeutic kind of benefits. So if you've got a pet, a dog or a cat, lots of young people have pets or horses or rabbits, or, you know, it could be anything, you know, or going out for a nature walk as well. You know, we're maybe in the city, I suppose, yeah, we are, and we're quite lucky, the surrounding areas, we do have the opportunity for that. Listening to music. Some people have special playlists for certain emotions, so it might be worth encouraging your young person to set up an angry playlist, a sad playlist, a happy playlist. Talking about how you feel. Maybe if you've got some hand lotion, a sort of hand massage. And obviously, you know, breathing and relaxation exercises. And again, I can forward some sheets with some exercises on that you can do, but it's generally breathing in, but breathing in really from what they say, your diaphragm, so from your belly button, so a deep breath, and then breathing out for longer than your in breath. So if you're breathing in for 3 seconds, breathe out for 6 seconds, and repeating that to just calm things down for you, and that will soothe the body and it will calm things down. maybe to allow you to do something else that's a bit more distracting. If there's a need to control, so sometimes this comes from a need to control, so things like writing lists, tidying up, writing a letter saying everything you're feeling and tearing it up, or even we've spoken to people about writing a letter to a person and not sending it. So if there's a friend that someone's particularly angry with, or a teacher, or a family member, you know, maybe encouraging somebody to write them a letter about how they're feeling, not specifically to send it, but actually, you know, to write them that letter to get those feelings out. You know, things like, I don't know how many young people would go and weed a garden, but you don't know, actually. Some of our young people do like gardening. Paired muscle relaxation. And again, I can send you some sheets on paired muscle relaxation, yeah? So
yes, please.
It's something that you can do even at home. So you can't see my hands. So I'll see if I move the camera. So even something as simple as just clenching your fists really, really tight, and then unclenching really quickly. Yeah. So you can even do that when you're on the bus, probably. No one would notice. I'm doing it under my desk now. You can't notice that I'm doing that. Yeah, you could do it at school. And you can do that with all your muscles. So you can do that with your biceps. Yeah. And you can start from the head and the neck and work your way all the way down the body and do paired muscle relaxation all the way down. And again, that is a proven method of helping you to relax and that need for control. So if there's perhaps numbness, feeling disconnected, so flicking elastic bands on the wrists, or even a hair, I haven't got a hair tie, I've normally got one, or a hair tie. Yeah, some people say also drawing with red pen on the wrist might be a way. Holding ice cubes. So this is temperature can be quite useful, because what happens is, say, I don't know, I'm on a ferry. There is a reason to this story, but I'll tell you the story. So say I'm on a ferry going to the Isle of Wight, yeah, and I fall in the water. My body will hit the water, and the water will be cold, and it will trigger something called the dive reflex. And what the dive reflex does is it slows down my heart rate straight away. Yeah, it sends my blood to the parts of my body and my brain that need it, and not the parts that don't. And it activates something called your parasympathetic nervous system, yeah, to just calm you down so that you can deal with the situation. So that's a biological response. And it's there really because I've fallen off the ferry, okay, and I need to keep myself alive. Okay, so I guess if we're thinking about when we're feeling really overwhelmed, yeah, there's a pesky part of our brain, okay, shaped like an almond, called the amygdala. And what that does is it takes over, it hijacks all of our frontal lobe, which is where we do all of our thinking and all of our planning and all of our being able to be calm and measured, and it takes over. And the reason it takes over is because we've perceived something as a threat. Yeah. And it was really useful when we didn't have modern life. So it's really useful when we were, you know, more primitive. We perhaps would be out hunting, we'd come across a wild animal, and this little pesky almond bit of our brain would take over, and it would prepare us to either fight, yeah, flight, so run away, or freeze, yeah. And what some of the things that it does is it gives us a surge of adrenaline that can make you feel really angry, but that's also so that you can run really quickly. Also, unfortunately, it causes you to need to go to the toilet. The reason for that is because if you need to run really quickly, the lighter you are, the faster you're going to be. Yeah. So there's a good biological reason for why our brain does this. The problem is that nowadays our brain can't tell the difference between something that's really upsetting and something that is a real physical threat. That part of our brain can't tell the difference. The thinking part can, but the little almond shaped part can't. But that part will take over. Okay, so when we're holding ice cubes, you can hold them in your hand, but if you put them around this bit of your face, okay, so your forehead, around your eyes, sort of over your nose, yeah? So either ice cubes, frozen peas, a bottle that you've got in the freezer that's frozen, dunk your head in cold water in a sink. You do that for 30 seconds or more, that will trigger that dive reflex, okay? And that will physically, automatically calm you down, okay? You can replicate that with having a very cold shower as well. Again, you need to be careful with the shock of temperature, okay? So if you've got a really serious heart condition, it's probably best to speak to your doctor before you try something like that. But for most of us who don't have any serious medical conditions, it's fine. Yeah. So, you know, it is a good, useful tool. Not everyone likes it, but I think there's a lot of good biological evidence to say it works. Again, smell. So a lot of memories are triggered by smells. Yeah, so smells can be a strong trigger for memory, good and bad. So if you have a certain smell that perhaps triggers off a good memory, so a certain perfume that you really like, or maybe somebody really likes lavender oil, you can maybe spray that onto a tissue or onto your sleeve. And if you're feeling upset or distressed, it's there. At the moment with masks, it's quite easy. Yeah, I'll spray my favorite perfume into my mask, put that on. Yeah, and that can be really calming and soothing. So it's all about how do we self-soothe. Yeah, so what can we do instead of resorting to the self-harm? What other things can we do? So again, if we're thinking the driver for this is shame or guilt, maybe there's somebody who you can stop spending time with who's treating you unkindly. A lot of our young people have people that they think are friends, but actually when we sit down and we talk to them about those relationships, they're not particularly friendly. Yeah, so how do we support our young people maybe to recognize that, and to find more positive influences and relationships? And I guess that one can be a difficult one, but it is important for us to think about. And then just recognizing actually that we all make mistakes, so none of us are perfect, no one knows everything, and we all will get things wrong sometimes, and to just try and be kind for ourselves as well, and try and understand the reasons why we do what we do. Yeah, because nobody does things for no reason at all. There's always going to be a driver there, whether it's a conscious thought, or it might be an unconscious thought, or it might be to do with a relationship. Yeah, or there might be a biological, reason behind, impulsivity. Maybe somebody's got ADHD and they're struggling to regulate that way. So, there are lots of explanations for why people behave the way they do. And I think in CAMHS, we try and formulate that into, is it biological? So is there an underlying biological reason, ADHD, autism, depression, anxiety? Is there a cognitive reason? So is there something about the way we're thinking that's affecting how we're feeling, that's affecting how we behave, that's reinforcing that thought? Is it systemic? So is there something in our system, in our relationships, either in the family or at school or in the friendship group, that's causing that reaction? Is it an unconscious thought? Yeah, to do with trauma or something else? So we try and think about, or is there a behavioural reason? So we all learn, we all have learnt behaviours. So I do something, X happens, yeah? I learn that, but it's an association behaviour. When we were babies, we all learn, I touched the kettle, it's hot, it hurts, I'm not going to touch it again. That's a learnt behaviour in a simple form. And that happens to us all the time. So is there a learnt behaviour going on? So it's worth trying to think about it maybe in that sort of sphere, and just try and understand the drivers behind behind what's going on.
Is it harder to help with strategies for self-harm if somebody does have sort of autism or ADHD with that really rigid thinking? Are there sort of particular strategies around that, or is it the sort of you just keep plodding through the same strategies you'd use for anyone else?
I think if somebody, so it's about what would work for that young person. So I think if someone's really, really rigid thinking, then I think you need to give them some really kind of concrete things to do. Yeah, does that make sense?
Yeah.
So giving them some kind of wishy-washy, maybe go for a walk, maybe do this, perhaps try that, probably wouldn't work with someone who's really concrete with autism, because they'd be like, well, I don't really understand this. So it might be, you know, sitting down with them and doing that, maybe thoughts, feelings, behaviors, or an ABC chart, and thinking, okay, so when you feel like this, you know, do this, punch the bag. When you feel like that, do this.
Okay.
And then they'll tell you if it works or not. And if it doesn't work, then you say, okay, that hasn't worked, try this one.
Yeah.
So try not to give, I think probably don't give lots of options, and do things that are quite concrete, that are easy to understand.
Yeah. Yeah, that makes sense.
And I think with ADHD, again, is recognizing the difficulty with controlling the impulsivity, because again, that's really difficult with ADHD, isn't it? Because that is part of the symptoms. So it's about maybe some of the temperature strategies or some of the other strategies that just help them a little bit with that impulse control. And again, yeah, I am in talks with Professor Cortese actually about you know, specifically around ADHD and about different kind of ways of managing it. So we have got some ideas up our sleeve of maybe some research that we might want to do in that area, because actually I've done a bit of research, literature searches, and there isn't a lot out there about how we support young people with ADHD to manage their emotions.
Yeah, no, I think that's absolutely true.
Yeah, and there isn't really, there aren't that many recognised kind of treatments really for it. You know, there's only so much you can do with medication, even when it's optimised.
Yeah.
So I think a lot more needs to be done in that area, but a lot of these strategies probably will be helpful. But again, it's about trying what will work for the young person. And also, I think with ADHD, it's about maybe, you know, getting them to write it down visually so that they don't forget, or having a little card to remind them. And if there are different steps to something, you know, breaking it down so there's not too many things for them to remember, or too many steps in a strategy.
Yeah.
Does that make sense?
Yeah, absolutely. Yeah, thank you.
Yeah, so again, here it's just, writing letters, finding creative ways to express people. So, you know, a lot of my young people write songs or raps. Some people like to do dance, poetry, movement, singing, physical exercise. So again, there's lots of strategies. So I think that's, sorry, I ran out of time to do the last few slides, so I might finish the presentation off with the last few bits and send those to you. In terms of what CAMHS do, obviously when someone gets referred in, we'll do an initial assessment with somebody, and then we've got a pathway at the moment where we run an emotional coping skills group. So that is, it's taken from a therapy called dialectical behaviour therapy, which was developed by a psychologist in the States called Marsha Linehan, who herself actually struggled with thoughts of suicide and self-harm. And she thought, well, actually, what, you know, I need to build a life worth living for myself. This is terrible. You know, how can we help people with this type of difficulty? So she developed DBT, dialectical behaviour therapy, and the dialectical bit is really to do with two things that are true but seemingly opposite. So what it means is I'm struggling with my emotions, and I'm self-harming, but I'm doing the best I can. However, I also need to find better ways of coping. Yeah. Does that make sense? So she borrowed from other therapies, and we've got DBT. So one of the things in DBTs is learning practical skills, and we've gone through a lot of them already, actually. So things like the temperature, changing your temperature, the intense exercise, the paired muscle relaxation. They're part of what they call the crisis or tip skills, but there are lots of other things in there as well. So we run an 8-week skills group, and that's really to help people where perhaps they've just started having those types of behaviours. The self-harming hasn't really got really terrible yet, and the levels of risk are not really high. And that's 8 weeks of skills group, and we're running that at the moment 4 times a year. So we've got 4 of those groups each year now, so that's the schedule.
And how can you get onto those groups? You just sort of do a referral to CAMHS, and then they will select to see whether that's the right place to go.
Yeah, the way that you get onto that group is someone gets referred into CAMHS who has problems managing their emotions and is self-harming. They'll have an initial assessment, and then somebody will say, well, I think maybe emotional coping skills or DBT would be useful, and I'll explain the difference. And then what you do is you get what we call a formulation appointment with somebody who is trained in DBT, and you discuss with that person whether emotional coping skills or DBT, or actually something that isn't that, would be helpful, because it is a big commitment. Because and the reason for that is, so DBT, I'll just explain that, is the skills group, which is once a week but over a long period of time. So it's actually 6 months program, and you have to attend every week. And in addition, you also get a one-to-one DBT trained practitioner, so a one-to-one DBT therapist, who will coach you in those skills, and how to manage, as well as other emotional difficulties. So that's full DBT for the young person, and emotional coping skills is just 8 weeks of skills, with no additional one-to-one. So those are the. So we only have a maximum of 12 places on each group. Because of resource.
Yeah, I expect there's quite a waiting list, isn't there, to get onto it?
No, we have a bit of a wait for we have a little bit of a wait for our formulation appointments. So at the moment we're booking into June for those. So a couple of people waiting for full DBT at the moment, and at the moment, after the formulation appointments, we're feeding people straight into the next emotional coping skills group. Demand is increasing, and I fear that we will be building up.
Yes, I feel like it's coming, isn't it? Yeah. Okay, that's really useful. Thank you.
Is that all okay? Sorry, I might have rambled a bit.
No, I think it's been so helpful. And all the strategies have been really useful, and good to know what CAMHS are offering actually around that. I wasn't aware of some of those services, so that's really useful. I don't know if anyone's got any questions that they quickly want to ask. No, we're nearly out of time. We've got a couple of minutes. If you do, feel free to put it in the chat or just to unmute and ask.
So, okay, what's the difference between self-harm and self-injurious behaviour? It's just a difference in terms, really.
Okay.
Yeah, so self-injury, self-harm.
Same thing. Okay.
Okay, that's interesting, because my sorry, Jill mutes because we're in the same room. I've been told my daughter doesn't exhibit self-harm. She exhibits self-injurious behaviour. Okay,
I don't know if you want to talk about the behaviours or not, because it's a bit personal.
I shan't on a recording, if that's okay.
But
yeah.
If you want, I'm sure Jill can put you in contact with me, and I can phone you and we can have a discussion, a private discussion, if that's helpful.
That's great. Thank you very much.
Yeah. Okay.
Okay. Don't think we've got any other.
I'm just thinking it might be to do with the level of harm. So I don't know. It could be somebody's perceiving the difference between something like pulling hair out or eyelashes or scratching to cutting or burning or something that's more serious. So it might be somebody's making that kind of distinction. But, you know, at the end of the day, I think the important thing is about what's driving that.
Yeah. No, yeah, absolutely.
So I think what someone is doing is important, but the more important thing in my view is in terms of how do we tackle it is why.
Yeah, that's great, thank you. Right, I don't think we've got anyone else. I think we've covered so many things, so much detail. It's sort of be really good to go away and reflect on it all. It's been it's been so helpful, honestly.
Okay, sorry.
Please don't apologize. It's been absolutely brilliant. I'm going to stick the poll up if I can now, for people, just really quickly. It's just a yes, no, 3 questions, just so that we can get some feedback about, you know, what else there might be and whether or not to ask you to come back again and do some more. But thank you ever so much for your time and for all the work you've put in for this. I know the video is going to be really, really well received by everyone that, you know, hasn't been here today, and it's going to be fantastic to be able to refer people back to this. We get a lot of questions on self-harm amongst the group, so really, really appreciate your time, and thank you everyone else for coming along today.
That's okay. And you know, if you want me to come back or you want me to do like more regular things around self-harm, just let me know and we'll see what we can do.
I really appreciate that. Thank you ever so much.
Okay.
Right. Thanks, everyone. We'll see you next time.
Thank you.
Thank you.
Thanks
Bye-bye.
for your time. Bye-bye.
Bye.